You know, with your digestion patients, with your Crohn's, colitis, IBS, celiac, it helps to have a questionnaire. It helps for the patient to establish what their baseline is, what they're going through in that moment. So my questionnaire is broken down into categories. The first few categories are directly related to digestion. Feeling that bowels do not empty completely. Lower abdominal pain by passing stool or gas, with relief by, alternating constipation, diarrhea, diarrhea, constipation, hard, dry, or small stool, coated tongue or fuzzy debris on the tongue. And all of these are rated as 0, 1, 2, or 3, as in no problems, low problems, pretty frequent, and all the time type things. Coated tongue or fuzzy debris on tongue, that's kind of a tell right there. Pass large amount of foul-smelling gas. Yes, those patients are pleasant to be around in confined spaces. More than 3 bowel movements a day. Use laxatives frequently. Excessive belching, burping, or bloating. Gas immediately following a meal. Offensive breath. Get accused of that sometimes after some Chinese food or something like that. Difficult bowel movements. Sense of fullness during and after meals. Difficulty digesting fruits and vegetables. Undigested foods found in stools. Not a pretty picture. Category 3 is stomach pain, burning or aching 1 to 4 hours after eating. Use antacids. Feel hungry an hour or 2 after eating. Heartburn when lying down or bending forward. Temporary relief from antacids. Food, milk, carbonated beverages. Digestive problems subside with rest and relaxation. Heartburn due to spicy foods, chocolate, citrus, peppers, alcohol, and caffeine. Category 4, roughage and fiber cause constipation. Indigestion and fullness last 2 to 4 hours after eating. Pain, tenderness, soreness on left side under rib cage. Excessive passage of gas. Nausea and or vomiting. Stool undigested, foul smelling, mucus-like, greasy, or poorly formed. Kind of see a pattern with that? You might be thinking, gallbladder. Frequent urination. Increased thirst and appetite. Difficulty losing weight. Category 5, greasy or high-fat foods cause distress. Lower bowel gas and or bloating, several hours after eating. Bitter metallic taste in mouth, especially in the morning. Unexplained itchy skin, yellowish cast eyes. Stool color alternates from clay color to normal brown. Reddened skin, especially palms. Dry or flaky skin and or hair. Now that might overlap with the thyroid condition. History of gallbladder attacks or stones, and have you had your gallbladder removed? Yes or no? If you have, then if they have, then they will need support for that pretty much for a lifetime. But you can help them. You can prevent them from having problems and help them with the digestive problems they do have. So this is what I go through with patients because it's just easier. They fill it out ahead of time, and it helps us decide if we're going to see them for a consultation, whether or not we want to work with them, if we want to accept them as a patient.